Nancy Hatton, and I'm here in the lobby of the outpatient of Sierra Nevada Memorial Hospital, and with me is Kimberly Parker, and Kimberly is the
Executive Director of Sierra Nevada Memorial Hospital Foundation.
How about that to put on your business card? All right, so Kimberly, we are here because there are exciting things happening here in the hospital, and the new cardio services have been upgraded.
Well, that's what we're going to be talking about during this program. Is we have great cardiac services here at the hospital, but we're working to have even greater services. We're doing a campaign through the Hospital Foundation, Heart of Gold, and we're going to take you on a little bit of a tour through our cardiac areas and let you meet a few people, hear about what we're currently doing, and then we'll come back and we'll have a chance to talk about some of the things that we are looking to do in the future as well. So we're very excited about that.
All right, so what are we doing sitting here?
That's right, off we should go.
Okay. I'm upstairs here with Dr. Mallory. Thank you for taking the time. So what do you do here?
This is the Cardiology Department of Sierra Nevada Memorial Hospital. We do stress tests, we do echocardiograms, we do Holter monitors, monitor pacemakers, put in pacemakers. Sometimes we shock people out of abnormal rhythms. And this is the center for where we organize and coordinate all those things.
Okay, let's go back. I know what a treadmill looks like. But what's an echocardiogram and why is it important for somebody to have one?
Echocardiogram is a standard technology in medicine to image the heart. This is the echocardiogram machine here next to us. It uses ultrasound to make a picture. We can watch heart speed in real time. We can look at valves and pumps, see why people are short of breath or having chest pain or passing out.
If somebody's watching this program and they say, gee, I think I need one, you just don't decide you need one. What's the procedure for these procedures?
Start with your family doctor.
Mm-hmm.
Tell him what your symptoms are and he'll help you figure out what the appropriate test would be.
Now, what does this specific hospital do if you find something very serious?
We are closely aligned with Mercy General Hospital in Sacramento,
mm-hmm.
which does many of the invasive, impressive things that we do not do, like open heart surgery and valve replacements, implantable defibrillators, vascular reconstruction, etc. So our patients who need angiograms of the heart or heart surgery, interventions in the coronaries go down to Sacramento to Mercy, where they're very well cared for, and we see them when they come back.
And I think it's important to know that Mercy Hospital is nationally acclaimed for heart.
One of the very best in the country. Many years they have the lowest death rate in the United States for things like open heart surgery.
And it's a short commute.
busy, very excellent place. And actually, my father had open heart surgery, and that's where I sent him.
Mm-hmm. Well, there's a good recommendation.
I like my father.
So go back. So what exactly, or what do you do here in this hospital? Because you just don't diagnose and ship them down, do you?
Well, if somebody needs an intervention, we diagnose them and ship them down. We do put in pacemakers here. Okay. And we treat people with medicines and drugs and things like that. But most of the expensive, aggressive interventions are done down there.
Okay. Is there anything else that we should know? Well, do you have a healthy heart?
Do I have a healthy heart?
I didn't ask that. What should the general population do to...
The general population? Well, don't smoke. Exercise. Exercise is probably the most important thing anyone can do to stay healthy. Even walking 30 minutes a day. The American College of Cardiology recommends 30 minutes of walking to all human beings. Presumably that's over age 6 or 9 months, but that's their recommendation.
And we're not talking big box stores or the mall. We're talking walking.
Walking, yeah, a nice brisk 30-minute walk.
That's the second or third time I've heard walking and exercise. I think we should probably do it.
Absolutely. Maybe we could invite Michelle Hughes to walk over here and talk to us too.
Okay, that would be a good deal.
Thank you.
Thank you. Thank you, Michelle, for coming over. Now, your title and your job here is?
I am the cardiology clinical specialist here at Sierra Nevada's echocardiography lab and cardiology department. So that means I kind of oversee the day-to-day operations of all of our diagnostic testing. I oversee the current accreditation that we have received nationally for our echo lab and make sure that we stay accredited, which is a really important thing now. basically all of the echo labs in the country will have to have that accreditation, and we saw that coming. So we got our accreditation for the first time 4 years ago,
Well,
and reaccredited just this last year.
okay, so it's every 4 years that you keep
Every
up
three.
with your
Mhm.
every 3. Okay.
And so it's a concurrent quality assurance type program, and it also makes sure that we know what we say we know here, and we do what we say we do. So it's a huge honor,
Mhm.
and it was a lot of hard work for all of our staff, but it is a necessity.
Now, is this a state or or national?
It's national.
National accreditation.
Yes, and the hospital is currently looking at getting a chest pain accreditation. So a chest pain center accreditation, which some of the bigger hospitals in Sacramento have that. And that is something that is also a national accreditation, but it puts into place a program that fast tracks our patients who come in with chest pain. There is a specific set of guidelines that most of them were already doing, so for us it would be a pretty easy switch over to become accredited in that. It takes time, there are lots of hoops to jump through, and most certainly we will be able to do that, but we are looking at that in the future.
So if I come to the emergency room with chest pains, it's diagnosed, you just don't give me an aspirin and send me home.
No.
You would most likely then come up or make another appointment to come up, or how does that all work?
It depends. It really depends on, our emergency room physicians are expert at sorting out the patients who are really in trouble and the ones who maybe have some heartburn or have something wrong with the chest wall, the muscles in the chest wall. At any rate, when one comes to the emergency room with chest pain, it is essential that we rule out that it is coronary artery disease, which is what causes heart attacks. So some people, the ones who are more serious, who have maybe a little change in their first set of laboratory draw, their EKG isn't exactly normal, so those folks will be kept overnight, and there's a series of lab tests that are drawn every 6 hours. And if it is ruled out that they've actually had a heart attack, which is the most important thing, we want to make sure that you're not currently having a heart attack. At that point, if that is ruled out, then most of those folks come to us into our diagnostic cardiology lab, and we do a form of a stress test, either walking on the treadmill or for folks who can't walk, like say someone who has bad knees or a bad back, or even folks who are preoperative, who have an abnormal EKG with a broken hip. We can give those folks a drug that simulates what exercise does.
Ooh.
Yeah.
It's not for the general public, huh? To
No.
simulate what you're doing?
It's a little weird, you know, people are laying there on the bed and the heart rate's going up, sort of like when you're walking, but when you walk, you don't notice it because you're moving. It's a little uncomfortable, but it is the only way to do it for some folks, and thank goodness we have an alternative to walking on the treadmill. At any rate, most of those folks come in and have a stress echocardiogram, so we take pictures before and after the form of stress, either walking or pharmacological. And the cardiologist is here, watches all of that happening, and decides at that time by what he sees on the images and what he sees on the EKG, whether a patient may have a narrowing in one of their coronary arteries. If that happens, then they are sent down to Sacramento, either urgently if there were serious changes, or scheduling it as an outpatient type procedure. And that rings true for either the patients who are in the hospital, and even if someone goes to their physician and says they've been having chest pain or tightness, shortness of breath when they walk up hills, those folks come in as outpatients. And sometimes those folks also have a positive stress test and end up having to go to Sacramento to get that evaluated.
So it's a pretty complete diagnostic little room you've got here.
Yeah.
And what does this machine do over here that looks like everybody's
This
dead?
this is the computer that will show us throughout the entire stress test whether one is walking on the treadmill or having it pharmacologically, what the EKG is doing. And it looks at different sets of EKG leads, and it basically shows us changes that the physician will see. In this department, between our department and cardiac rehab, we do about 30,000 patient visits a year.
That was going to be my next
So-
question. How many people do you
So
diagnose?
this is something that's going on usually all day long in our department. We have a system down, and we just work through that system and get everybody done each day.
Wow. Is there anything else that you do that we should know as the consumer?
Since we're talking about the entire cardiology area, I should mention that cardiac rehab we also have an accredited cardiac rehab program here, nationally accredited. And part of the 30,000 visits a year that I was talking about includes those cardiac rehab folks.
I think we're going to be going down there to watch these people
Okay, yeah.
exercise.
That is a wonderful program, but I think that it's important to know that we have a full circle here. So when folks come and they are in urgent need with their chest pain, and we see them here in the hospital, they come through our diagnostic lab. If they have to be sent down the hill to have either stents placed through an angiogram or bypass surgery, those folks are then sent back up here to one of our cardiologists and go through our cardiac rehab program. So everything is done close to home for them. They don't have to go back and forth to Sacramento, which is really nice for those of us who hate driving down to Sacramento.
Yeah, right, particularly to do some stress tests or something.
Right.
Yeah, no, it's amazing what this hospital does. It sits on the hill.
We really, it's a little secret. We have pretty much everything they have in Sacramento, but in our own little town. We're very blessed to have what we have.
It's wonderful. Well, thank you, Michelle. It's been a pleasure talking
Me
with
too.
you.
Thanks.
And now we are going down to the rehab. And now I'm in a little room with Katie Ellis. And Katie, you are?
I am the coordinator of cardiac rehab. I'm an exercise physiologist.
Wow. And we are in a little private room because the cardiac rehab is a very, very busy place. So tell us a little bit about what you do.
Sure. We have folks come in 3 times a week for monitored exercise. And the type of people that we see have had some sort of an issue with their heart. They may have had a heart attack or a stent. They may have had something more involved like bypass surgery or a valve replaced or repaired, or they might have angina. Their physician will refer them to the cardiac rehab department where we do monitored exercise and lifestyle modification. So a lot of education around healthy eating, stress management, diabetes management, things like that.
So the machines, we're not talking about a gym here,
Right.
physical fitness. To go to your facility, you need to be referred for a physician. And then you just don't get on the machine and have some trainer do something. So all these people are highly monitored for it's an individual program, isn't it?
Exactly. So we meet with each person who is referred to the program for about an hour privately to go over their goals and their health history. What did they have done? What are they returning to? Are they going back to work? Will there be lifting requirements? Also the risk factors. We have to look and make a treatment plan for how can we get them where they need to be. How do we manage their blood pressure? So we meet with folks individually, design an exercise program that is suited to their needs and health history, and then we begin the exercise program where we're watching their heart rhythm, their heart rate, their oxygen saturation, their blood pressure, and other variables. And then we usually have them in our program for about 3 months, and then they graduate. They can graduate to any number of programs. We have a program at the hospital where they can continue to pay out of pocket to receive our services and use our facility and be monitored by the clinical staff. Some people join local gyms, some join walking clubs or go to the fairgrounds, but we try to encourage folks to know that exercise is now a part of their life moving forward. How can we make that work for them?
We just heard from Dr. Mallory about how important exercise is. So this is practicing what everybody preaches, to rebuild your strength and your stamina.
Exactly.
On an individual basis, and I think that's important too.
Right.
What do you have a typical client, or yes, you do?
Well, we do. About 15% of our participants have diabetes, so that's a large focus. Weight loss is often a goal for people too. Blood pressure management. But I have patients in their 30s and some in their 90s.
Wow.
It's, men and women, some are very fit and some are very deconditioned. So that's where that initial meeting is so valuable to make a plan for them. So it's also a lot of fun. If you've ever chatted with someone who's come through cardiac rehab, it's supportive, there are friendships, a lot of camaraderie and laughter. So it's enjoyable. When people get to the end of their program, oftentimes they're saying, I love this. This is really working for me. I'm losing weight. I'm motivated. I'm more optimistic. I have less stress, I know how to cope better. How do I keep this going? And so we're excited that we can keep people in the program.
Well, the exercise is total body. It's not just for your limbs or something,
Right.
and building up your heart.
And it's, for many people, realizing that mind-body connection. Wow, you know, I have an awareness of my breathing, or when I exercise, it makes me feel improved body image or reduced stress. I sleep better, things like that. Those realizations are revealed when people get going in the program.
I know from a personal standpoint, the more fun. The more fun you make it, the
You're
quicker
right.
the time goes, and there you are. You've done something good for yourself, and you've laughed and had a good time.
Right, absolutely. Some people, when they complete the clinical monitoring piece, they do decide to do home exercise. And that is fabulous if that suits you. If you're motivated to get on that piece of equipment you have at home, maybe you turn on music or watch your favorite program or just look out the window. And other people say, you know what, that's just not for me. I need to be expected at an appointment or have the friendship so that really the time does tick by faster. And they say, wow, 30 minutes has gone by. This has been so much fun.
Now, you talked about out-of-pocket expense when you are referred by a physician for those first 4 months. Is that usually covered by most insurance?
It is usually covered by insurance, and Medicare covers a portion of the cost, and secondaries tend to pick up the remainder. But we look into what the payment expectation is for folks before they start. We're hoping that people don't have to pay at all for the monitored portion. The maintenance program is self-pay, and it is $60 per month to come to the hospital 2 days a week for that clinical supervised exercise program. So that works for some people. And some people join local gyms. They might join South Yuba Club or the Wildwood Fitness Center or Club Sierra. There are some wonderful gyms in our community, and that fits some people's interests too.
Now, about how many clients do you have?
We have 60 to 70 every day, Monday
Wow.
through Friday.
And so all of these people have been diagnosed with a heart problem.
Right.
I think we all got to get
Right.
out. I mean, this is a really good program, but perhaps we should not be here. Take care of ourselves so that we don't have to be here.
Right, and we help in that way too. We have education classes that are open to the public. So you don't have to have had a physician referral or a cardiac issue to come to what we call our Heart Smart education class. Those are 7 classes, about an hour and a half each, open to the public. We often advertise that in the union, or you can find it on the hospital website. And those cover things like healthy eating, menu planning, stress management, cardiac medicines, anatomy and physiology of the heart. So that's a great way for folks who are thinking, hey, I have a risk factor or two, or I just need some ideas on better eating habits. You can certainly call the hospital main line or look up on the website and come to the education classes.
And let's talk about the website just for a minute, and then we'll keep going over it because it's a fun, interactive website. You've got cartoons and pictures of hearts and colonoscopies and all sorts of things going on. So it would be SNM
Org.
So Sierra Nevada Memorial Hospital, just go in and it lists all those programs that, and it's kind of fun with the cartoons.
Right, right. We have an exciting campaign that's happening right now also called the Heart of Gold campaign, and this is a fundraiser, and part of the funds raised are to benefit the cardiac rehab department. We're looking forward to purchasing a new telemetry monitoring system that will allow us to monitor more patients simultaneously, so we can treat more people.
The hospital is growing and expanding, and it's really exciting for us who live here, and in a good way.
Right.
Well, Katie, thank you very much for this time, and you've got to get back to the treadmill.
That's right. Thank you.
Okay. Now I have with me Debbie Plass. Debbie, you are,
I'm Vice President of Marketing and Business Development at Sierra Nevada Memorial Hospital.
and we have already been introduced to Kimberly of the foundation. So Debbie, tell me a little bit about what you do for marketing.
Well, first of all, thank you for having us here today. It's really great to be together. And marketing at a hospital, some people say, well, what do you have to market at a hospital? Sick people come to the hospital regardless of what you say. But actually, it's more about communicating the services that we have here at the hospital and letting the community know what they can expect when they do come here. So my job has to do with really communicating to the general public and to employees and doctors here at the hospital. There's something new that we're starting too.
I was just going to say, this hospital is growing at leaps and bounds. And tell us about where we're going.
Okay, where we're going is right down Highway 20 to the Penn Valley area. We recognize that there are a lot of really wonderful residents in that community that are already utilizing our lab draw station that's been there now for over 10 years. And so we're looking to expand that into more of a diagnostic clinic where we're going to have the ability to do things like heart testing, EKGs, echocardiograms, and also some x-rays, because in order to get an x-ray right now you have to come up the hill to Grass Valley. So providing that service, and then as a secondary part of that whole focus of the diagnostic clinic, we're also going to put in a multi-specialty clinic where doctors in this community can go to the Penn Valley area and see patients there for the community's convenience, to see patients where they live right in their community and make it nice for them.
Wow, already having the blood draw and then doing the x-rays and some diagnostic, that's the first step when something's wrong. And we don't have to come up here, which is a wonderful
that's the
thing.
idea.
That's great. And so, again, I'm big on people just don't show up at these clinics. You need a doctor's referral to go there.
You know, typically your primary care doctor or whoever you're seeing is going to provide you with a prescription or a diagnostic test slip to get this test done. There are some things, though, that you can just walk in for and have done on your own, and we'll make those really clear as we move along.
So the doctors are going to come down to Penn Valley.
They are going to come down to Penn Valley.
This is exciting for us.
I have to just say, Betsy, too, that it touches my heart because the actual Penn Valley lab station was my first project when I started here many years ago, working with people that your community knows so well, Barbara Nix and Mike Caswell and Nancy Spindler, just an incredible group of people. And so it's really wonderful to see this project come full circle around, and for Sierra Nevada Memorial Hospital to really literally be close to home in the Penn Valley backyard.
If this keeps going, we can call ourselves the Penn Valley Annex.
Yeah.
There you go.
Absolutely. All right, all of this costs money with the new equipment and everything else. Would you like to address that for a little bit of time here?
Sure. As you well know, part of the reason we really wanted everybody to see a little bit about our cardiac services is Sierra Nevada Memorial Hospital is really working hard to advance our service of care to the next level. And to that end, the foundation is working in tandem with our hospital. We've launched Heart of Gold, which is a campaign that mixes funding for equipment for both the cardiac side, which we saw with Dr. Mallory and with Michelle, the cardiac rehab side, which we saw with Katie, and then as we talked about as well, the chest pain accreditation piece of it. Our support then is really supportive also of being able to take some of these services down to the Penn Valley area, because some of the equipment that we're getting, unlike what we have here at our hospital right now, is going to be portable. And that's one of the main reasons that the work at the clinic's going to be possible, is that the newer equipment that we're getting, believe it or not, some of it will pack down almost into a suitcase size that can be put in someone's trunk of their car and taken down. So it's going to benefit patients that are in our hospital needing our care, both on the diagnostic and kind of initial side, on the preventative side, when they are involved with coming back after they've had some care perhaps down at the Mercy Heart Institute that Dr. Mallory talked a little bit about earlier. And then our ability through Penn Valley initially to really have a portability with the program that is going to take services out to the people in our community. And would you like to know a little bit about the pieces
I
of
was
equipment?
just going to ask, because it's a big word, so feel free.
Well, and Debbie will know that it's kind of like tomato, so some people may pronounce supine ergometer, some people say ergometer is one of the pieces of equipment. and some EKG, Siemens echocardiogram piece of equipment. As Katie talked about, the monitoring, system that is going to be in cardiac rehab. That's part of what they already have there. That will allow them to treat more patients simultaneously, monitoring them for their care. But for example, the ergometer is a piece of equipment we really don't have right now. That someone who comes into the cardiac part of the program that has had maybe a severe incident and really isn't ready to quite get up on that treadmill or that bicycle. This is a piece of equipment that's flat and you lay on, and so they can do some of those testing. So you're not like trying to do some of that bike riding or other kinds of things. You're kind of more at a parallel. And that's going to be very, very important for us. We've not had that before.
Right. Supine just simply means to recline in the medical world terms. Absolutely. We use a lot of acronyms in medical terms.
Right. Right.
Absolutely. And then the one part that I really wanted to address a bit was the chest pain accreditation, because people in the Penn Valley area may remember when we did a couple years ago our Stroke of Luck campaign, and we were primarily going after national certification as a primary stroke center. This is a national accreditation, similar in nature in terms of how we have to set up all our protocols and all of those. And many of these things our hospital has in place, they've been doing. The part of this that's expensive for a hospital and makes it more challenging to do is that initial work that we're helping to provide the seed funding for, and that is that the clinical staff, the physicians, the nursing staff, all have to go through a certain level of training. And that training is very expensive. And so the dollars that we raise through the campaign for that part of our project are going to enable us to provide that high-level training for all the staff, because one of the elements of the accreditation is you can't go after accreditation until you can show you've been through that step. Right. And as we promised when we did the Stroke of Luck campaign, and I believe the same will be absolutely true for the chest pain accreditation, and that is the expense is getting it up and going. Once it's up and going, it is really something the hospital can maintain under its own operating budget. With Stroke of Luck, we've already been through a stroke recertification, and we didn't need to go back to our community and ask for any additional dollars for that. We have been recertified, and that is what we expect to happen once we get our chest pain accreditation as well.
Now, can you open the facility without the accreditation?
Oh yeah, I mean, the chest pain accreditation is just really, and Debbie can possibly speak to this as well, but it's kind of that gold seal that you want to have on your hospital. And as I said, our hospital is really doing the things already that really are called for, the protocols and all of that. But what it really will show our public is that we really are benchmarking ourselves to the very, very best practices out there, and that we have put our staff through all this advanced training that is gonna give us that gold seal.
And just like with the Stroke Center now, people know that we are a primary stroke center certified by the American Cardiology Society. Anyway. And that allows people to rest assured that when they come to the emergency department, things are going to start happening right at the door. And we make the promise to our community that we provide the highest level care that they can get anywhere throughout the United States. And that's also going to be true, or still is true, for cardiac. It just takes us to that next level.
Right. Can we go back? Do we have a target date of the operation being up and running for the Penn Valley area?
We are in the final process of business plan approval. Once that is completed, and I'd say that happens in the next 30 to 45 days, then it's going to take us approximately 90 days to complete it. So sometime early 2012 is what we're looking at.
And that's just around the corner.
Just around the corner.
And with the campaign, we're a fourth of a way to our goal. We're over $50,000 to our goal. And our hope, Kimberly's world is sometimes a little different. I'd love to be, towards our campaign goal by the end of the calendar year. We might go into the first quarter of next year by the time all the pieces are laid. But, we do know that, as we get into this time of year, this is when people people are thinking about the philanthropic choices of where they'd like to, give some of their philanthropic gifts at the end of the year. And we hope the Hospital Foundation would be one of that. And I'd love to go ahead and give our phone number, which is 530-477-9700. And we hope that if people have questions, would like a cardiac tour, because we do tours through the cardiac part of our hospital, would just like an information pack, might want us to come speak to a club and organization, we'd love to do all of that in our community.
Well, what do you do to raise the money? You just don't give a phone number and expect the dollars to be rolling in.
No, we do actually a wide variety of things.
Cookies? You bake cookies?
No, probably wouldn't want my baking skills involved in this. But first of all, our board is very active. Our board works within the community to talk to people to get the messages out, and we have a very generous community that will step forward. We do direct mail. We have a newsletter, and through the hospital marketing, we really try to put some collateral pieces out and about. We work through the cardiac and cardiac rehab departments here to make sure that the people that are receiving services also, know about what's going on. We do personal asks. We are doing martinis and a movie, which is going to be in early February.
Okay, now we're talking.
That's going to be over at the Del Oro, and in Heart Month, which we're going to celebrate, and also in celebration of Valentine's Day, we're going to show on the big screen Casablanca.
I am very impressed with the staff that we've been meeting. It seems like everybody's a really happy place. And the staff did something good for the hospital, which is unique in most business senses, with this lovely, lovely garden. Do you want to talk about how that came about?
Sure. We have a committee at the hospital that's called Share the Spirit, and Share the Spirit are employees that help select projects throughout our hospital for which there's no other funding. And everything through Share the Spirit is paid for by employee donations. And so a couple years ago, the employees were asked what is something that they would like to have, and a memorial tribute garden in honor of our physicians, our nurses, our other staff that have worked at the hospital over the years was really at the very, very top of the list. And we had little challenges in terms of where space-wise we could work, so we spent a couple years kind of looking at different locations and trying to figure out all that. But now we have this beautiful garden that, quite frankly, Share the Spirit had some dollars to be able to spend, but probably wouldn't have happened without also a generous community. And I have to just mention my Rotary Club, which is the 49er Breakfast Club, which really provided a huge amount of the labor. Along with Brian Burham, who is, key at the hospital in terms of all the landscaping, and Walt Bringman, who oversees the department, to kind of coordinate all this. And so it was really a wonderful community hospital, business partnership. And as you saw, it's a gorgeous, gorgeous area that's a respite for patients, for people perhaps that are in meetings in our conference room, for family members that want a quiet place, a gorgeous fountain that is in the garden that was funded by Rotary. That was kind of their mark that they also, put into the garden. And we're just thrilled. And we hope that as people come over to the hospital, it can sometimes be a stressful time. We hope that when they're looking to just sneak away for a few minutes with a book or a quiet moment or something, that's an area that they'll look forward to stopping by.
That's very rare. I think the bottom line is this is not a little rural clinic. It is an upscale hospital having multiple facilities, and most importantly, the staff is happy.
Yes, and the staff supported this, and I think it's really important that our community knows that our staff, our physician community, they all think very highly of our hospital, and they're right there, part of our team, both in the campaign. You saw Dr. Mallory, where all the cardiologists, they've been working with us on this project, as well as the cardiac staff. And our Share the Spirit committee, which represents our employees, are getting ready to go on their next year campaign, and so that's when we approach our employees for their gifts to the hospital, and they've been very, very generous.
Well, I had a thought. Can I just come and tour, or do you give regular tours of the hospital? My thought was that perhaps we should check it out before we check in.
Yeah, and that's a really good question. Actually, the foundation does what I call Service of Excellence tours. And again, our phone number, if you're interested, is 530-477-9700. 477-9700. And in a Service of Excellence tour, we generally pick 3 or 4 parts of the hospital that we think are pretty incredible areas, and somewhat depending on who's coming in their interest, we'll kind of select and show them, you know, some of the things that are going on. What Debbie can attest to is what we hear so often in our community is, oh my goodness, I had no idea our hospital did that. I had no idea our hospital had this level of service or program. And again, going back to the cardiac project, when you think of Heart of Gold and you think of our cardiac services and Sierra Nevada Memorial Hospital, we're serving, you know, we're handling 30,000 patient visits a year. That's a lot of patient visits. It's a critical, important need for our community. And so it is really important that people understand and know what's here and available to them.
So the bottom line is come check it out before you have to be here. And if you have to be here, you're in a good place.
You are.
Yeah.
You are indeed.
Well, thank you very much. It's been a very informative time.
Thank you for having us, Betsy.
Thank you, Betsy. Really appreciate it.